Hello and welcome everybody to the Animal Eye Guy. Today we're going to be talking about cherry eye. Cherry eye is a prolapse of the gland of the third eyelid. The unique name for this is because it looks like a pink little lump in the medial corner of the eye, which resembles a cherry. We don't exactly know why it happens. We do know that it happens in younger animals. There are some genetic, or there's some evidence of some genetic links in some breeds of dogs, but the exact mechanism why it happens is still a mystery until this day. But we do think that there's a poor attachment between the gland itself, which is on the back side of the third eyelid, and the underlying tissue, and that seems to when the gland swells up, that seems to then prolapse, and then as it's exposed to the environment, it becomes more inflamed. So at least that's what we think it's doing at the moment. Yes, so both eyes can be affected. Oftentimes they present with cherry eye on one side, and then usually takes a few months for the other side to prolapse as well. In some cases they can just remain on one eye, so it doesn't mean that it has to happen on both eyes. As a general rule, the older they get, if they've not had a prolapse in the other side, the chances of it becomes less and less likely. Well, any dog breed can get cherry eye. We do see cherry eye quite commonly in English bulldogs and French bulldogs. We also see it in giant breed dogs, such as Great Danes, bull mastiffs. We occasionally also see it in Maltese terriers and Lhasa Apsos and other breeds like that. So we generally recommend not to remove the cherry eyes. The third eyelid gland is a very important gland which contributes about 30 to 40% to the tear film. And if you remove the gland, particularly in breeds where the risk of dry eye is higher, such as in English bulldogs, the chance of them developing dry eye is increased, which is why we don't recommend removing the gland, as you're increasing the likelihood of dry eye at a later date. There's different ways on how to surgically reposition the third eyelid gland. One of the most common procedures is the so-called Morgan pocket technique, but there's also other positioning techniques where the gland can be anchored either to the cartilage of the third eyelid or to the tissue surrounding the eye and the orbit. Sometimes we might need to anchor the gland to one of the muscles, which is at the bottom of the eye. So there's a number of different techniques, but the most common technique is usually what we call the so-called Morgan pocket technique. And we're going to have a look at that in this very short video clip, just to give you an idea of what that looks like. So here we can see a picture of what it looks like pre-operatively, so just before the operation. So this is a classic third eyelid gland prolapse. So this is done under general anesthetic. We're putting what we call an eyelid speculum in the eyelid to open this up, and then we're going to put some sutures into the third eyelid to position it properly. Right, and then we can see the gland. We're making a small incision on the front side of the third eyelid gland, and then on the back side. This tends to bleed quite a lot, just because it's a very sort of vascular tissue. And then we're undermining the tissue, so we're creating a pocket. So we have to make a little pocket at the front as well as at the back of this gland, so the gland can slide into that pocket. And then we're going to make a bigger pocket on the back of the third eyelid gland. And then once the pocket is large enough to reposition the gland, we're then going to start suturing this up. So we're placing a suture on the outside of the third eyelid. And then we're going through the third eyelid and then closing the pocket on the back side. And you can do this in 1 or 2 layers. I tend to perform this procedure in 2 layers. So here we're just going to quickly show you how this is done. And then we've gone out through the other side and anchored the gland on the other side. And then to finish, so we've done the second layer, and we're now going to anchor this on the outside of the third eyelid gland. So this has been done in 2 layers, and this is the finished result. So after this procedure, your animal will go home, usually wearing a head collar, which can be a bit annoying, and then some eye medication for a few weeks, usually 10 days to 2 weeks or so, just as a precaution so there's no infection. Some lubricating eye drops, usually some pain relief as well. And then once the gland and once the pocket has healed over, the stitches will break down by themselves, so they're self-dissolving, so we don't need to remove those. They're usually gone within about 5-6 weeks. They can sometimes look a little bit swollen immediately after the procedure and for the first few weeks until that suture material is broken down completely. Sometimes, particularly in English Bulldogs, that third eyelid gland and the third eyelid itself may remain slightly enlarged and slightly reddened permanently, which, as long as the gland is where it's supposed to be and it's not causing any problems, is not a problem. We generally expect a success rate of about 80 to 95%, or slightly higher even than that. There is a slightly higher risk of problems in giant breed dogs and in English Bulldogs, but as a general rule we expect this operation to be successful. The biggest complication that we're worried about with cherry eye surgery is obviously a reprolapse. Luckily it doesn't happen very often. There is a complication rate of somewhere between 5 to 15% complication rate. That largely depends on the dog breed. Usually giant dog breeds and English Bulldogs have got a slightly higher risk of that happening. There's other complications that can sometimes result from this, such as an ulcer, which luckily doesn't happen very often, but any kind of operation where you're very close to the eye can potentially result in an ulcer of the cornea. Cyst formation is another one. So the gland should have an escape route for the fluid which is being produced to come out of the third eyelid. And in some cases, if that seals over completely, you might end up with a cyst which may need to be reoperated in order to create a bypass for the tear production. And then sometimes in giant breed dogs and in English Bulldogs, we have sort of a permanent thickening of the third eyelid or the third eyelid gland, although it's in the correct position, but it may not look cosmetically quite as appealing as we would like. I wouldn't necessarily consider that a major complication. It's at the end of the day, it's more of a cosmetic issue, but not a functional issue for the eye as such. Well, if we do nothing, the third eyelid gland will remain outside of its normal natural position, and it will gradually start losing function and will likely develop into dry eye disease at some point. So thank you for watching this video. Hopefully this was educational for you, and if you have any more questions, feel free to drop us a comment at the bottom of the website. Thank you. Bye-bye.